Welcome back to Living Local. When you think of chiropractic care, you probably think of neck and pain treatment and back pain. You may be surprised to know that researchers have found getting adjusted can also reduce anxiety, a common mental health issue affecting 40 million Americans. Joining us in studio, chiropractor Dr. Travis Howell. Welcome to Living Local. It's really great to talk about this particular topic today, especially with what's going on in the world.
For sure.
Yeah.
It's great to be here.
Now, how long have you been practicing chiropractic, and what got you into this line of work in the first place?
Well, I graduated Palmer here in the Quad Cities in 2009, and I opened my own practice here back in the Quad Cities. We moved away for a couple years, but back in the Quad Cities in 2013. And I'd been working with families, but really had a focus of trying to reach those families that were looking more than just the back pain and the neck pain. I helped people with that, but we had a vision of helping more. And probably a little bit through my wife, who's a speech pathologist, so I've been working with kids for pretty much that whole time. And so what we started to notice is as we went through working with kids and families is anxiety is super prevalent, and even more now than ever. So kind of just that's how the practice kind of evolved into where we are.
Yeah, so why might someone consider chiropractic care as a tool for anxiety management?
Well, anxiety is a super complex challenge that doesn't really look the same for anybody that suffers from it. But what we know is the commonality within anxiety is there's really an imbalance within our system, within our nervous system. We've got a side that controls our stress response and a side that's our calm response, just to keep it really basic. And that's what chiropractors do. We work on that balance, making sure that your system is balanced as balanced as possible between those two components.
Yeah. So what is happening within the brain and the nervous system then? You can explain this to us. When somebody is affected by anxiety, what does that look like?
Sure. So I'll try to keep it super simple, at least for this segment. Well, when we're shifted into that stress response, right? Most people are spending too much time over there. So in reality, we should have most of our day on that calm side of the nervous system. But especially in 2020, we've shifted over and we're spending way more time in that stress response. It's there for survival, so like think running away from a tiger, which should just be there for short periods of time just for us to survive.
Yeah.
And what's happened is we're spending most of our day over there. And so when that happens to somebody, they're not able to function well, and they're not able to predict what's coming next, and they get really stuck in that stress response, and that's what drives a lot of people's anxieties. No matter what the cause, it could be trauma, it could be a whole bunch of causes, but the actual result is that imbalance.
Well, what effect does world events like COVID-19 have on someone suffering with anxiety, and why? Because this is a huge topic right now.
So one of the major components of anxiety is you're unable to see the future, okay? So we're unable to predict. So we know, based on our previous experience through brain development and life, if we do one thing, we're probably going, we know the result of most of the things in our life. Well, today in 2020, we don't know what today brings. We don't know what tomorrow brings. Every time we think we've got this whole thing figured out,
it changes.
Right? And something else is happening, or there's some kind of uptick or change, right? So we're unable to predict, and so it just drives an anxiety through the roof. We're seeing more and more patients with anxiety complaints now than we've ever seen.
That's totally understandable. I mean, even people without anxiety have probably felt some levels of anxiety throughout all of this as well. What if someone has anxiety about going to the chiropractor? Because I've definitely seen this one,
For sure. So along those lines of not knowing what to expect, right, unable to predict what's going to happen, people, either they've maybe heard a story from someone or they're just really unsure about the whole process. Maybe they saw it on TV. That can drive that anxiety, that uneasiness, okay? So a good way to get over that is watching segments like this, right? Calling the office, checking out office websites. Like most websites have a what to expect tab. But we'll walk you through the entire process and make it really easy for everybody.
So you brought a few things here. I wanted to kind of ask you what the Neuropulse is all about.
Sure. So this is part of that, showing people what to expect. This is the technology we utilize in the office because when somebody comes into us with a pain complaint, it's somewhat easy to identify, hey, where is this coming from?
Right.
But when we're looking at something more neurologically based like anxiety, or if we're looking at any of those neurological challenges, we need to see inside the nervous system. And so these three technologies here is what we utilize in the office. Super safe, super painless. I mean, it tickles a little bit, but it doesn't hurt. But it gives us a good snapshot of what the nervous system actually is doing right now, and if we're in or out of balance between that gas pedal or that stress side and that calm side.
Yeah, so you can, even if somebody is like, hey, I'm fine, everything's fine, and it feels like they're drowning anyway on the inside, you'll be able to tell and be able to help them and diagnose where they're having some of the issues.
Right. So our entire goal, we can't unfortunately get rid of someone's stress, but we can measure where the imbalances are, and through chiropractic adjustments, research has shown that we can actually improve your ability to respond positively to your stress, which then can take that anxiety level down.
Right, and it can probably retrain that neural pathway in the brain to how you respond to stress. That's fabulous. Now, how do we know what to adjust and how often to adjust?
Sure, so that comes with clinical experience and this technology and lots of cases of different patients that have come into the office, what their history looks like. So we do a full evaluation and assessment to make sure that it's not just a cookie cutter response. It's like, hey, this is the technology we're going to use on day one, and we're going to use it throughout the care plan to make sure that we're on pace, and it tells us, are we on track? Do we need to make a change? Right. And how we adapt that care plan throughout.
Right, and bio-individuality, right? You're treating the patient and their individual situation. It's not like a one-size-fits-all.
Correct.
That's what I really love about that. Well, Dr. Travis Howell, thank you so much for coming on Living Local today. How can someone get a hold of you?
So our office is in Davenport. You can go to our website. I think you guys are posting that on here, like our Facebook page, website. I've also got a free resource for anybody that wants just like top 5 tips that I have for anxiety management. If you just go to our website, it's howelldc.com and then /resources. There's a free download on there for tips and tricks for anxiety. That's amazing. Thank you so much for providing this service in our community. More information at Howell Chiropractic on Facebook. We'll also have those details posted on ourquadcities.com. More Living Local continues after this.